Everyone, this is the Atmosphere. I'm from VEM004. So this is podcast 3 and the topic is a day in the life of a vet nurse. Today I'm gonna perform as a vet assistant to the vaccination process. So please enjoy the video. So before the patient step in the examination room, we have to make sure that the desk is clean to keep good hygiene. So you're here for new vaccination, right? So before we process our vaccination, I'm gonna ask you a few questions. So first, what's the name of the patient? Tom, sir. And the age of the patient? 2 years old, sir. So may I know the date of birth? March 8, 2019, sir. So the species is canine, and the breed is Dalmatian, and the sex is male, sir. For diet, how many times do you feed him a day? 2 times, sir. So is she given supplemental medications? No, sir. And does he have a genetic history problems? No. Do you let him stay indoor or outdoor? Indoor, sir. So is he in contact with other animals? No. So that's it. So we'll continue our PE. Before we start our PE, it is important to read body language of the pet. For me, the pet is pretty relaxed and calm, so we're gonna continue our PE. The weight should be established when the animal enters the exam area. With my naked eye, the pet is ideal weight because if you look at it from the top view, the body is balanced with slight weights. The pet is small, so it should be enough with scale. If you don't have enough scale, you can use standard barrel scale method. Now we'll continue head exam to check is there any redness or scratch in the eye. During pupil reflex test, the pupil should be constricted when the light is on and the pupil should be dilated when the light is removed. Then we need to check the ear for redness, source or odor. And finally, we need to check the nose, check the color and consistency, objects in the nose, or swallowing problems. We need to check the oral cavity, which includes the gums, mouth, teeth, tongue, and throat. We can examine the teeth by lifting the lip. Check is there any stains, odor, or broken teeth. And if the gums color is pink, is normal. We need to check tongue and throat that is there any foreign objects or wounds. We need to check respiratory rate in the chest area with the stethoscope. You can count the number of inhales within 30 seconds and you can multiply with 2. And we also need to check the breathing pattern as well. We need to check the heart rate around the cardiac area, which is the point of left elbow. We need to count the number of heartbeats within 30 seconds and multiply with 2. The resting heartbeat of a dog should be 70 ppm to 100 ppm. We need to check the temperature of the pet before vaccination. To measure the temperature first, we need to disinfect the tip of the thermometer with an alcohol. Then we can insert 1/4 or 1/2 length of the tip of the thermometer into the rectum of the pet. Insert it slightly so that it can touch the rectum wall. The temperature of a dog is 37.9 to 39.9 degrees Celsius. Before we give vaccination to the patient, we have to make sure that the patient is healthy. And giving vaccination is only done by licensed veterinarians. The vaccine must be kept in refrigerator between 2 to 8 degrees Celsius. This is single dose vaccine, and the one is tolerant and the other one is lyophilized vaccine. Now we have to mix the vaccine. we need to apply Asian gloves, and then we need to soak a cotton ball with an alcohol. And wipe the top of each fill with the alcohol. We need to obtain the liquid diluent fill and invert the bottle. Set the needle into the center of the rubber vial. We need to remove entire contents of vial into the syringe. And then we need to withdraw the contents into the syringe. And we need to remove the needle from the vial and recap the needle. We need to peel off the sticker from the vial and label each syringe with the peel-off sticker. And we have to place the syringe in the treatment area. After vaccination, we can wrap the vaccination area, price the patient. We can also treat the patient to be a positive environment. Keep in mind that it is important to give enough time for educational advice after vaccination and, of course, with a polite manner. After vaccination, we should advise or request to the clients or pet owners these following things. So first, you need to take care of your pet to avoid stress for the whole day, and you need to avoid bathing for next several days. And you need to double check the dates on the vaccination card to avoid failure establishing immunity. And please keep your pet indoor and take a complete booster, because they can't have enough immune to virus after first dose. And if your pet is suffering from allergic reactions, contact immediately to your vet. Symptoms are vomiting, diarrhea, itchy skin, swelling around the face, neck or eyes, or maybe in difficult in breathing and collapse. So that's it. You may take your pet to your home, and don't forget to follow up in the booster day. And then we need to clean up again for the health and clean hygiene. Empty vaccines, vials and syringes are considered as medical waste and require careful disposal. The needle is a sharp object that contaminated with animal tissue. It must be disposed in the appropriate bin that is labeled for sharp objects. The needle must be kept on before being separated from the plastic syringe. The syringe must be disposed in a different bin that is exclusive only for used syringe. Some cleaned recycled syringe to give oral liquid medication. Vial must be disposed in a bin exclusive for only vaccine vials. All sticker must be removed before disposal. They are not recommended for recycling. This is the end of my podcast, and I really hope I can deliver some useful and important messages to you. So, bye, stay safe.
We got history, got me feeling the nostalgia when you look at me.